Part D is designed and led by pharmacists. The community pharmacist has played a major role in helping the seniors navigate through the different plan designs, options, and drugs. So we believe this is the right time for us to introduce a more pharmacy-centric plan.
When I talk to patients about all the different plans that are out there, there's a few things that patients come back and tell me that they would like to have. Number one, they'd like to talk to their pharmacist, and they'd like to come to their pharmacy of choice. The concern that we have at our 6 pharmacies is that there are some networks that never list my name. And we have patients that have traded with us even since the 50s before I was the owner. We would hate to see that relationship broken up. I would rather have a preferred network where I know patients can come here, have a very reasonable copay, and it's not the vice versa situation as a patient really wants to come see me, but I'm not on that preferred network of that card that they have. What's really exciting is might even help me get new patients and grow our business.
As you know, there are a lot of plans out in the marketplace. And if you're a new beneficiary, it's very confusing, right? Which one do I pick? Are they the right plans for me? Am I paying the right amount? And I guess the beneficiary is also looking at their overall cost of insurance, not just for the the prescription side, but also on the medical side. What's the best program you can put together? And these licensed agents, these professionals who really understand this landscape really well, provide that type of advice.
First of all, our presence in the pharmacy and assisting their clients with a Part D enrollment, which can be very confusing to a lot of the people turning 65. So that, of course, is a value in itself. And then secondly, beyond that, we will get our instructions and we will just do basically what that pharmacist wishes us to do. Anything that creates value for them, that's our presence there, and that's our main goal.
So Smart D has set out for 2013 to create a preferred network of 22,000 pharmacies through RX Ally. And the objective there is RX Ally consists of independent pharmacies, regional chains, and a large national chain as well. And within this network, we will bring or keep those beneficiaries who were used to going to their local community pharmacy at the community pharmacies. I think it's very important to have oversight from the government, from CMS on this. And it's a very regulated program, as you know, and compliance is critical. I think the whole objective there, or the idea is, we have to protect the beneficiary at the end of the day, right? We have to make sure that, first of all, the beneficiary does get access to the right medications, is in the right plan that makes sense for them, but and is not being discriminated against or being compromised in any way.
As an agent being inside of the pharmacy, not only we build a great relationship in the community with the business partners and whatnot, but also that gives you as an agent a great opportunity to build new relationships with potential clients.
It just gives you a chance to build up trust and a relationship with them that at a later time moves into other items, other insurance products, other protection products. And it all started with just meeting at a prescription drugstore.
We think there is a great future in independent pharmacy. We currently have 6 pharmacies in Georgia. I think the success we have had is because, number one, our staff, and number two, we have focused on the patient being healthy, not just which disease states they have. We focused on how we can help, how to keep them healthy, how they take their medications and understand their medications.
This is a plan designed and led by pharmacists. And the point of distribution, it's the only retail-centric plan that's going to be out there, right? The focus of all the campaigns on how it's going to be marketed is within the stores, within all the CMS guidelines. And this is an opportunity for the independent stores and the regional chains to participate in a preferred network.
One of the concerns a lot of my colleagues have called is that there is a big pharmacy, and I'll even tell you the name, it's Walgreens. Some people have been concerned. I'm not concerned about Walgreens. Walgreens, in my opinion, is run by pharmacists, and they have a lot of great pharmacists. And they also have told me they're focused on the wellness side of the business and not just filling the prescription. So if I had to pick a partner, and it was going to be in the chain environment, it would be Walgreens. I respect them, and I think they're a very good pharmacy.
Walgreens is participating in this network because of its position in the marketplace around the role of the community pharmacist. And if you look at Walgreens' history, it's a 111-year-old company, has been at the forefront of many different things within the pharmacy space in terms of delivering care to patients. And recently has very publicly stated that they want to protect the role that the pharmacist plays within the store. So I think this is a nice way for everybody to get together in the network, hence the reason why Walgreens participates in the RX Ally network. If you want to keep your senior coming to your store and spending their money at your store, you need to participate in this type of a network.
I've read quite a bit about Smart D, and I'm excited.